Good afternoon, everyone. We'll wait a few more minutes before we start our presentation, our community health webinar. For those of you who are joining in on telephone, could you please tell me the name and organization you work for? I see a 605-773-6744.
Hi, this is Pamela Schackemeyer with the South Dakota Department of Health. I am the Heart Disease and Stroke Prevention Coordinator, or Director.
Thank you, Pamela. Let's see, a 402-857-2300. Okay.
That'd be Phil Jakewith.
Oh, hey, how's it going, Phil?
Good.
Glad you could join.
Thanks.
And also, those who are new to the community health webinar, can I get an introduction from you? I see Michelle. I'm not sure if that's a new one.
Yep. Hello, I'm Michelle. I am an evaluator at Asset.
Oh, nice to meet you, Michelle.
Thank you. Nice to meet you.
The issue we talked about.
Hi, Eugene.
Since you're a guest.
Hey, Bella.
Hi.
Right.
That's just getting it so that your screen.
Hi, Elaine.
Okay.
Okay.
Great. Thank you.
Elaine, you forgot to
Hello, can you hear me okay?
Hello, Nettie. Yes, we can hear you. Glad you could join.
Thank you. Hi, Elaine. Okay, this is the webinar, correct? Or is this a meeting?
This is a webinar for the team-based care. So you're good.
Okay, so I think we will begin. For those who do not know, my name is Eugene Gallego Jr., and I am a program coordinator for Good Health and Wellness. I've been working for a little over a year, and today is the Community Health Department webinar. This is the last one within our fiscal year, and then we'll end up starting some new ones. But today, Elaine Clement will be presenting on it'll be an introduction introduction to team-based care. And for those who are new to joining, if you could please mute your speaker. So just so that there's no interruptions. But we'll start off with an introduction to Elaine, and then I'll turn the keys over to Elaine. But Elaine is an enrolled member of the Sault Ste. Marie tribe and Chippewa Indians and was born and raised in Sault Ste. Marie, Michigan. Elaine attended Lake Superior State University, where she received a bachelor's degree in business administration. Prior to joining the health board, she worked as a service coordinator for partnership with Native Americans, Great Plains region. Elaine also worked in a membership service with her tribe for 18 years. She enjoys spending time with her family and legal Miss Sophia. So right now I will, first let me make an announcement that we will be sending out evaluations afterwards. So if you could, later on towards the end of the presentation, please click the link onto the evaluation and we'll get that, and please get that filled out. So Elaine, whenever you're ready.
Okay. Can you hear me?
Yes.
Okay. Okay. Okay, can you see my screen?
Nothing yet. You gotta click the share screen. It's right next to
Oh,
the bottom tab.
okay. Okay, so today is just an introduction to building your team for team-based care. We're going to talk about the different definitions of what team-based care is, the values that you could put together for your team, the principles of that, and then just talking a little bit about improving patient care, the program that the IHS is using. What we'd like to do for sub-awardees and those others that are attending is just give an introduction to team-based care, and what we're going to do in the future on our webinar series is focus on clinical linkages. So today, just talking about teams in healthcare and talking about how teams get built and then how it is all beneficial to the patient. So teams in healthcare have taken many forms. For example, there have been disaster response teams, teams that care for people at home, office-based care teams, teams limited to one clinician, and patient teams that include the patient and loved ones, as well as a number of other supporting health professionals. Teams in healthcare can be large or small. They can be centralized or dispersed, virtual or face-to-face, while their tasks can be focused or brief, or they can be very broad or lengthy. Regardless of the specific task, patients and settings and effective teams throughout the healthcare are guided by basic principles that can be measured, compared, learned, and replicated. Today I'll share with you the team-based care values and principles, and then an intro to improving patient care, the IHS system. The value of team-based approach to healthcare is recognized for more than a decade, and it's been shown that a team-based approach has value to the learning of the health system. By preventing medical errors and improving patient-centered outcomes, this will all benefit chronic disease management. Team-based care is one of the guiding principles of the learning health system, and it stresses interdependence, efficient care coordination, and a culture that encourages parity among all team members. Teamwork can be reinforced at all levels, from the leadership to the unit level. Individual patients should understand that they are working all together on a team. So just taking a look at the couple objectives that I have here today, just defining what team-based care is and the values going through them. Healthcare has changed very dramatically in the past 20 years. The rapidity of change will continue to accelerate as both clinicians and patients integrate new technologies into their management of wellness, illness, and complicated aging. So let's take a look at what it is. When we take a look at team-based care, there's a provision of health services to individuals and families and their communities by at least 2 health providers who can work collaboratively with the patients and their caregivers to the extent preferred by each patient and to accomplish the shared goals within and across settings to achieve coordinated and high-quality care. So why is this beneficial? When we take a look at the physician-led team-based care, it engages a greater number of staff in patient care and affords physicians the time that they need to listen, think deeply, and develop relationships with patients. Team members are aware of the patient's health history and conditions and are thus better equipped to answer patients' between-visit questions, calls, and messages. As a result, all members of the physician-led team feel engaged in their key role of caring for the patient. So when we're establishing the teams, what we want to take a look at is the values of the team-based care. The values are derived from the beliefs and the actions. The belief can be, say, if you want to say exercise is good for my health, then the action needs to match up with that. That needs to be taken in an active role for this to have value for that person. So just looking at the 5 values characterized by most of the high-functioning teams in the healthcare, these values lay the groundwork for establishing the team. When we take a look at honesty in your team, team members put a high value on effective communication with the team, and then the transparency of the goals, decisions, the uncertainty, and the mistakes. For a high-functioning team, mutual trust and honesty are necessary. This will contribute to continued improvement for care. Discipline. Even when it may seem inconvenient, team members carry out their roles and responsibilities with discipline. Additionally, discipline is used to seek out and share new information to improve individuals and team function. Such discipline can help teams develop and stick to the standards and protocols. Another value of team-based care is creativity. It is beneficial to the team to tackle problems with creativity. Even when errors occur or an unanticipated bad outcome happens, this provides an opportunity to learn and improve the team. Another value is humility. Differences in training are recognized by the team. The belief is that one type of training or perspective is not uniformly superior to the training of others. Team members can rely on each other to recognize and avert failures, regardless of where they are in the hierarchy. And curiosity on your team, reflecting on the lessons learned in the daily activities and using them for continuous improvement in the individual work as well as team function. Now looking at the values that you've brought to your healthcare team are established, we can take a look at the 5 principles of team-based care. So we can look at the shared goals, the clear roles that are laid out, mutual trust of the team, effective communication, and measurable processes and outcomes. So looking at shared goals for the team-based care. The team, including the patient, where appropriate, family members, or other support persons, all work together to establish shared goals that reflect patient and family priorities. And these can be clearly articulated, understood, and supported by all team members. Many teams use their first meetings with patients and families to develop these shared goals. Clear roles for the team. There are clear expectations for each team member's functions, responsibilities, and accountabilities. These optimize the team's efficiency and often make possible for the team to take advantage of the division of labor, therefore accomplishing more than the sum of its parts. Principles of team-based care are mutual trust, where team members earn each other's trust, creating strong norms of give and take and greater opportunities for shared achievement. This enables team members to set clear goals and achieve shared goals in a more harmonious fashion. Effective communication. The team prioritizes and continuously refines its communication skills. They have consistent channels for candid and comprehensive communication, and it's important for the team to use this across all settings. And then taking a look at measurable processes and outcomes, the team agrees on and implements reliable and timely feedback on successes and failures in both the functioning of the team and the achievement of the team's goals. Performance can be improved upon immediately when these are used for tracking over time. So just switching over to what's currently going on with the Indian Health Service is the Improving Patient Care model. And Improving Patient Care program supports the IHS, the tribal and the urban Indian health programs, and reducing health disparities. The IPC, which is called programs establishing the patient-centered medical home model of care throughout the clinics and hospitals throughout the IHS area. So taking a look at improving patient care. We're going to take a look at, I'm going to share with you the anytime access to the care team, the well and sick care prevention and chronic care, and that's the area where we would like to focus mostly with our good health and wellness sub-awardees. That's our area for preventative and chronic care, and then that's how we fit in. And then the high quality and reliable care and a coordinated team-based care, and just looking at those fundamentals. So with the patient-centered medical home model, we're going to take a look at all the different areas. The IHS clinical leadership recognizes that the fundamental changes in our system of care are required in order to achieve new standards of care. With this IHS care model, this incorporates the following key elements. Starting at the top, looking at this model, anytime access to the care team. With every patient, they have a relationship with their provider, and the care team offers them consistent and reliable access. Patients will receive care when they need it, whether it be in person, via phone, or by secure messaging through a patient portal. Well care and sick care, which is the preventative and chronic care, patients become partners in their health by utilizing various methods of preventative care. This can be screening, checkups, nutritional and behavioral counseling, so they remain healthy, which reduces occurrences of sickness and disease. While working with their provider, patients can learn how to self-manage chronic disease and also engage in goal setting, problem solving, and action planning. So when we take a look at a lot of our Good Health and Wellness subawardees, this is kind of the area that we're looking at. We're looking at providing those community action plans to assist with that chronic disease management. And this is where we kind of fit into assisting in this patient and family-centered care for our community members. High quality and reliable care. Throughout all Indian healthcare providers have the skills and training for delivering the high quality and reliable care for our patients. System improvements will be made fully and enable providers to use those skills and remain current as the science changes over time. Measurable outcomes and data are used to make improvements and build better care systems of care. And then going to the coordinated team-based care approach. The care team approaches applies to creating highly functioning teams who are able to coordinate care that meets the needs of every patient. So this would consist of several providers, in a sense, wrapping around services for their patient. And then just looking at the outer frame and the support, the foundational layers that also support family-centered, patient family-centered care are community involvement and engagement. And then just looking at the entire community and how it's working together to push forward and improve overall health for their community and family members. The cultural and spiritual respect. IHS recognizes cultural and spiritual respect as a crucial component of healing. And many also take into holistic approaches, traditional practitioners or traditional approaches to also assist in the wellness or care for that patient. Integrated clinical and information systems. This would be with the medical record systems, which combine multiple information sources used in the care team. This ensures both holistic patient care and information security. Healthcare quality improves with the combined use of the electronic health records and patient management systems. And then also engage leadership. Healthcare quality improves as the facility leaders embrace improving patient care and focus staff energy on improving work. So taking a look at, this might be familiar to some of you who are working with this with our tribe, and moving forward into, as we move forward into our grants into year 3, 4, and 5, we want to continuously learn more about the team-based care approach, and then also whether you're in the clinics or if you're not, look at how we can tie some of this to our clinics, and that would be more clinical linkages. And we'll be putting together some more webinars for you that speak to that. I just want to put this out here. I'm no expert on any of this. I'm just laying this down for an introduction for all of us to have a base to start from, and then build upon, and as those needs come up for more information, to also get that information out to you. And then a lot of this information is found on the Indian Health Service website, and it's right under Improving Patient Care, and it goes into discussing all of the areas that IHS is working on, and going through that. And also, and it explains more in depth the model of improving care. I'm just giving a brief overview and introduction for it. They do have a team that also does presentations that go more in depth on it. And there's also a resource guide located on the website that goes into more depth when you're looking at improving patient care. So if you're working with a clinic that is implementing these things, how, you can see how your programming is fitting into this model, or how can we improve. If you're doing it now, and how can we improve upon those or share those with others. So, like I said, this was just a brief introduction to looking at team-based care approaches, the values behind it, the principles, and then how this is integrating into the model that IHS is currently using. We're looking at increasing our awareness and increasing our knowledge of building those clinical linkages, and working together with our CHRs and helping our team members, or helping our participants and community members manage and work with the chronic disease. So, and what we want to do is just have all of the services that we can available to our patients who are going through this and living with this, and then giving them the best care possible.
Well, thank you for the information and introduction to team-based care, Elaine. Right now, we will open it up to any questions that you may have.
Do you want us to write our questions into a box, or can we just ask you?
You can go ahead and ask them.
Okay. The one question I have is, on the site you gave www.ihs.gov IPC. Does it have the front page that gives the model or the image of the model? And if so, can we use that if we were to provide some type of health education training? Can we use an actual model, that the team-based approach model, the actual image? Can we print that off and use that as a part of our training?
That would be a question more directed for the IHS. I know there's contact information on there, and I can also forward you that link, Nettie, because
okay.
I know your program is a model program that is doing those community linkages specifically. And tomorrow we're going to talk more about those on our Good Health. I want to recognize Nettie and her program with the Omaha Tribe. We are going to be featuring her and her program as the community clinical linkages that they're working on. She's currently training her staff member Ashley, as a community health worker, and to become that and put those referrals together and get the patient to assist and manage their chronic disease, and get those referrals over to the IHS down in Omaha.
Thank you.
You're welcome.
So I guess that kind of leads me to my question that I have. In your experiences with your work, in what ways have you experienced or worked with team-based care? So now that I know that you did some work with Nettie, is there anything else?
Oh, from me or from Nettie?
From you.
From me?
Yeah.
We can talk about Nettie's program. Working with Nettie's program, they had to do another assessment for her community, for her county, I would say. They are spread out there in an urban Indian setting, However, they are still linked to the Omaha tribe and referring patients there. They do a lot of, at the Indian Center, they offer a lot. She explains it very eloquently. But we're hoping that we can take this and run with it in the next few years and have it be a model. She's off reservation based. Do you want to mention a couple things, Nettie?
I can, if that's okay.
Yes.
In regard to team-based care, first of all, we are under the Omaha Tribe of Nebraska. We are the Indian Center, Inc. here located in Lincoln, Nebraska, which is an urban setting. You're correct that I'm in a process of not only training Ashley, but we have been very successful with not only providing a diabetes risk assessment to our community members, our Native community members, but more so than that, we're also providing case management, which is very time consuming. In addition to that, we're working with our urban health center, which is Nebraska Urban Indian Health Center, and we are in the process of continuing further more concentrated meetings with the diabetes director for the Omaha Tribe of Nebraska, so that we can continue to provide that type of linkage for our Native community in the urban setting to the Omaha Tribe in their health settings. As you may know, as a part of the evaluation that was conducted, the results of that not only helped us to be able to solidify a position here in Lincoln, which is Ashley's position, but also it helped Omaha Tribe Carl T. Curtis be able to open up another clinic in Walden, Nebraska, and I think they're calling it Carl T. Curtis Jr. We are providing that type of linkage. I mean, we're just starting that process now. So the information that you provided to us really does speak to, making sure that the patient has a relationship with the provider, if I heard you correctly, is to make sure that the patient has an open communication with the provider so that they can feel welcome should they need to bring other community or family members to their doctor's appointment, and to have an open communication. I mean, that's one of the things that I really thought was important in your presentation, as well as the talking about the chronic disease management. I think that too I'm glad that you mentioned that. So I hope that answered your question. I hope that provided enough information.
Thank you, Nettie.
Thank you, Nettie. So it looks like we have a question in the chat. Deverell, Elaine, do you have any ideas about what the next team-based care webinar will be?
Oh yeah, that's understandable. So yeah, I will let people know, and I'll look forward to hearing from you.
We are looking at a couple of presenters. We're going to expand it. With each presentation, we'll get some more information to expand upon that. And this will be coming based on our requests from our sub-awardees who are working out there, and where they feel that our work is driven by their need. So whichever direction that they would like to take this, we'll take those into consideration and get presenters to feature those presenters who can answer those.
Thank you, Elaine. Okay, so if there's no more questions, if you can, please fill out the link for the feedback form that was sent out in the chat. If you can, fill that out. And also, our next month's webinar will be on October 12th, and Tinka Duran from Great Plains Colorectal Cancer Screening Initiative will be presenting on her topic. She's in the background where Elaine is. So please mark that down in your calendars. So that will be October 12th. Also, we will be sending a link in the emails, which will provide the recording for today's session. So if you can, forward that to anyone who you feel is interested within this webinar, as well as the feedback. And I'll be sending out that form in the email as well. So if we don't have any more questions, I would like to thank all of you for joining us today in today's webinar. And thank you, Elaine, in the introduction to team-based care information.
Eugene?
Yes.
It's me, the voice in your head.
Hey, Deborah. Is Mid Central Education, is that I could see
Brian.
Brian.
Bye, Brian.
The voice in your head.
Right?
What words of wisdom do you have, voice in your head?
No wisdom today. Just...
You guys have a good day. I'm going to go do this survey.
All right. See you, Brian.
Bye-bye.
Thanks for joining, Brian. All right, everyone, have a great day.